you're buying stuff on contract, but also, is it reasonable? Like, am I really going to fuss over $70 or $5 or $10, right, on this order? Or am I just going to go after the ones that are maybe $100 or $200 that will be a big deal? That's kind of my philosophy. But I mean, I try on my item master. So 2,000 items, I got less than 100 items that don't have a contract tied to it.
Without supplies, there's no surgery. Without products, there's no patient care. Welcome to Power Supply, the healthcare supply chain podcast focused on helping you navigate the intricacies of logistics, purchasing, contracting, and supplier relationships. Each episode, we speak with healthcare executives, supply chain leaders, and innovative entrepreneurs from across the country as they share their stories, experience, and expertise on the industry we love. From the loading dock to strategic sourcing, from buyers to the C-suite, and across the enterprise, we tackle the real-life issues impacting the healthcare supply chain. Whether you're tuning in for conversation or inspiration, we're glad you're here. You're just in time to hear it from the source and stock up on insight. So sit back and plug into Power Supply.
Today on Power Supply, we will speak with Matt Hoffmann, Director of Materials Management at Humboldt County Memorial Hospital. And if you out there are working in a critical access hospital setting, this episode is for you. We're going to be talking about leveraging an ERP to achieve GPO compliance. Obviously, lots of financial pressures on critical access facilities all around the country today in this environment. Matt, we met him on LinkedIn and invited him to join us on the show to talk about this particular area of experience that he has. And we're going to hear all about it today, Hayes.
Absolutely. Come on and jump on and listen to it. You're going to enjoy it. Matt's a great guy. Also, we have a tie-in as well. You'll learn about that. So come on and enjoy and look forward to listening along with him.
All right. We're going to be right back with Matt Hoffmann. Stay with us.
I'm Hayes Walder.
This is Gary Skinner.
And I'm Justin Poulin.
From the studios of Healthcare HQ, you're listening to Power Supply.
Joining us now, Matt Hoffmann, Director of Materials Management at Humboldt County Memorial Hospital. And we're going to be talking about leveraging an ERP to achieve GPO compliance in a critical access hospital setting. And I know we've had a few episodes around rural and community and critical access hospitals, but probably not enough episodes considering people are often wearing so many different hats in that setting. And so hopefully they glean some information from this podcast when they listen. But today, this conversation is for you. So Matt, thank you so much for coming on and joining us to talk about really, there's really three different conversations in this, and we're going to build it around the ERP conversation, but welcome to the show.
Thanks, Justin. I really appreciate you having me on the show today.
All right. I'm so excited. I just met, for our listeners today, I just met Matt
Hayes is
today.
right in. He's right in.
I'm jacked up. This is so good. I just met Matt no more than 5 minutes ago. However, for those who obviously you're listening to this, but we're on like a Zoom call. Matt, please tell me what's behind you and why are you so proud of it? Can you explain what I'm looking at or what the listeners, what you have in your office?
Sure, Hayes. What I have behind me right now is memorabilia from the Tennessee Volunteers. You know, it's my favorite college team. Liked them since, I was 6 or 5. My grandpa was a truck driver and he'd drive down to Knoxville. And, one of the things he did is he brought me back Smokey, the mascot. He brought me back the dog when I was like 5 or 6. And then ever since then, it clicked. So literally, I'm the only person in my family that likes the Tennessee Volunteers. Everybody else is Iowa
And
fans.
you like Iowa. And of course, we played them in a bowl and it was not a very good experience for the Iowa Hawkeyes. But anyway, thanks so much, Matt, for being on here. We're pumped.
All right, Matt. Well, now that we've established that you and Hayes are lifelong college football fast friends, I should say, maybe not lifelong, but fast friends. Why don't you tell us a little bit about your current role at Humboldt County Memorial Hospital?
Sure. So currently I'm the Director of Materials Management at Humboldt County Memorial Hospital. So literally I do everything from dispersing the supplies to the departments, to ordering, to managing staff, as well as buying the equipment, helping the departments with service agreements, looking over contracts, negotiating GPO pricing, making sure we're buying the proper, items on the GPO. So literally I do everything, where in most larger health systems, you actually have specialized people in each of those areas. So it's, like you said, wearing many hats. That's what I'm doing right now.
And like, did you get some mentorship, or how do you, if you're in a setting like that and you're wearing so many different hats, how do you even learn about the job or what you need to do? Did you come from a larger health system and then move into, a critical access facility? How do most people even get experience to move into that role?
So I was lucky. The first hospital I worked at was actually my hometown hospital, and the Director of Materials Management at that time, she knew me since I was like 5 years old. So, and I knew the CEO of the hospital. So it was my way to get in to really understand what's supply chain about in a hospital. Because I will tell you, in school, like in high school and college, that was not really something that is talked about. It's usually, nurses and doctors and stuff like that. So I got my, experience there it was an acute hospital, about 50 beds. And then from there, I really took off to, doing critical access hospitals for a while, and then a larger health system. Then now I'm back to critical access setting.
So what's also interesting is we're combining a number of different topics. Like I mentioned, we're going to talk a little bit about GPOs and compliance, and we're going to talk about the unique setting that is critical access. And then we're also going to blend in an ERP, but you happen to know a thing or two about ERPs, because as at least in the nursing profession, they love to say, and I'm a nurse, but when you go to the dark side and you join a supplier, right? So now that you're back from the dark side, what did you learn?
Yeah. So honestly, there's a lot of background setups that needs to be done in the ERP system. And it's something that I think most people in my role forget, that, the ERP system is only good as the data that's actually put into the system, right? Garbage in, garbage out. So, learning all that aspect, as well as what things can the system do to really make other processes efficient. Like, we're going to talk about how can we leverage the ERP to help with your GPO compliance, something we'll talk about later. That's some things I learned that year that I spent working for the ERP company that helped me to develop these ideas. So I'm not having to go back to the GPO website to make sure items are on contract or not.
Hey, Matt, just for a little bit of clarity, we got listeners all over the United States and the world, because I know Saventure promotes this overseas, OTO, if you will. Matt, give a little explanation. When you talk about rural, where are you at? What's it look like? How big's what's your area geographically? Kind of give us a little feedback so we have a level set the setting so we really can understand with the listeners.
Sure. So obviously I'm in Iowa, so we're literally probably an hour and a half from Des Moines, so north central Iowa. And the town that the hospital is located in there's 4,000 people in that town. But we have a lot of competition. We have hospitals 30 miles away in each direction that, you have to be competitive. And you don't just look at the clinical aspect of being competitive, right? I got to be competitive in supply chain too, to make sure I'm doing what I can to reduce costs.
For sure, Matt.
And bring more value to the organization.
Yeah, and I appreciate that, Matt. Just to understand that, because you do have to pivot and morph and be so many different hats, and just really sharing your experience helps us level set the ground. So I just wanted to understand what it looked like, where you were at. So thank you for that.
So as we kind of talk about ERP platforms, did you work with an ERP company that provided a solution to, acute hospitals and critical access hospitals? Are they all sort of created equal? I mean, I hear just about everybody these days seems like they're going through an ERP conversion or standing up a new one, but are they really kind of one size fits all across all the different, settings in healthcare?
Sure, that's a great question, Justin. From my perspective, no. You really got to look at it like when I was looking at, because we're in the process of implementing a new ERP system at the hospital I'm at now. And I really looked at it as what system, what ERP would really benefit the hospital. So I feel like there's ERPs that are designed more for the critical access hospitals. I also feel like there's ERP systems designed for your larger health systems where you have, like, I oversaw a central procurement department that had 26 buyers in it for 20 hospitals and 100 clinics, where I don't think the ERP system necessarily that I'm implementing at my hospital would be the best one for that, if that makes any sense.
What about in the reverse? Like you're kind of saying, like, I'm going to implement this one and critical access wouldn't really fit, kind of a larger health system. But what about the ones in the larger health systems? Are they a good fit for critical access? Is the only reason they're not there just cost prohibitive, or what would be some differences going the other direction?
So from my perspective, the hospital I'm working at now, they looked at that same ERP system where I worked at the larger health system, and it was not beneficial to that hospital. It's not cost. It's really the functionality when it comes down to it. And we were looking at Humboldt that we really wanted an ERP system that had a lot of reporting and that was, how do I want to say, high functioning for materials management. So we felt like the ERP that we're implementing now will help us attain those goals.
Matt, does it kind of lock into what your inventory controls are going to look like? Does it feed into that and you need something simple? I've seen some giant robust systems that you don't even use some of the technology. So you need something that's easier to use. You can have people coming in that can be trained up, get the ball rolling. It doesn't take a year or 2 years to really understand the system. Is that accurate, Matt?
Yeah, I think that's accurate, but also the system that I'm implementing is also very robust. Barcoding everything. Like I said, financial reports that honestly, when I was at the larger health system, that ERP that I couldn't pull that I can pull now. So that is a big thing for me. I mean, in our position, that's, we're trying to, forecast, what's our usage and what are we going to need to be buying. So that's a big deal for me.
One of the concepts that you and I talked about briefly when we were first getting introduced before you came on the show was like the concept of stock versus non-stock and your management philosophy around that. And I think that ties into a lot of what you were just saying about what you were looking for in an ERP. Yeah,
Justin, that's a great point. So from my perspective, a stock item, I would only stock something in the storeroom if it's used by two departments. If only one department's using it, we got to have it in that department because it's point of use. So that's my philosophy. I also feel like with the system that we're going to be implementing, mins and maxes, making sure that, that's set up appropriately. And that's one of those things that, you got to continually look at. It's not just a one and done thing. Like you should be reviewing that, quarterly, if not sometimes monthly, depending on, the spikes that we're having, like, with COVID right now. So it's something that should be continually reviewed.
When do you expect to go live with this new system? It's because it sounds like you've made the decision, but when's the go live?
July 1. I've already I literally built the item master from scratch. Wow. And it took me a good 2 months. Yes. Everything. Yep. So we have it started, we're starting our implementation calls in a couple weeks, and July 1 is our go live date.
It took you a couple of months to build the item master. Like, where did you even start with that? And I think this is, again, this is really good for people to understand. Like when we talk about wearing multiple hats, I mean, literally foundational work that is being done. And you still have to take care of all your other responsibilities.
Exactly. So literally I'm working on an item master and then somebody calls, hey, Matt, I need this. Okay. got to order that. Then I got to revert back to what I was working on the item master. So what I did was I looked at what was in the storeroom, right? What were my items in the storeroom? Was it on contract? Because that's a big thing for me. I am trying to be as GPO compliant as I can to get the best savings and, get those rebates. So really checking to make sure that those were on contract. And if there weren't, trying to find something that is comparable, and then working with my clinical teams to make sure that, it would work for them. I want to preface that I truly feel like the foundation of any, when you're doing those switches is you really have to build the relationships with those clinical teams. And if you don't have that, you're never going to progress to where you want to get to being compliant with the GPL. So that's very important. But working through that, I was lucky enough to get all that done. And then there were some items, obviously non-stock, that they had par sheets developed. So continue the same process. And literally our item master is only 2,000 items, but even today I'm still adding items to it.
And you will be.
Yeah. It's a work in progress, seeing them out and what's the new ones coming in. And Matt, I want to take a little bit further. You talked about bringing in your clinical teams. Who all is part of this process? Who are the key individuals at your location specifically, maybe you could share, that help support what you're trying to get done?
Sure. So I will say, I'm blessed to have some pretty good staff. I have a staff member in materials management. She's done an awesome job. The OR director, the ER director, the EMS director, med-surg, EVS, literally, there is not a department that I haven't touched in the 6 months that I've been there that I haven't switched product in. So it's really all the clinical leaders and really getting them to buy into it.
Is it easier to make those relationships in a critical access setting?
I think so, because you get to have some face-to-face. So the first thing I did was, try to understand their perspective on things. And, I can't really go around and start switching things unless I myself truly understand what the product does. So that's where my knowledge, I've been in supply chain and healthcare for over 13 years. So gaining that knowledge and stuff has really helped me, understand what the products are used for. And then really going to them hey, do we really need the Cadillac and the IV Start Kit, or can we go to this one that's on contract where we can, save $10,000 to $20,000 a year?
So you're saying you like Cadillac?
I don't. No.
It really speaks, though, to just the financial pressures you're under in the critical access setting. That's obviously a big focus for you is GPO compliance because you want the rebates and the savings. And, times have never been, tougher, I think, financially, especially because you can only do so much with cost controls and you can only negotiate so much with the volumes that you're doing, right? So you're working with the GPO to be able to do that. Is another goal of the ERP to just automate as much as possible? Are you just trying to automate everything and kind of go take a step back and look at things from a higher level? And, how far do you want to go with automation?
Yeah, that's a great question. So yes, I want to automate as much as I can, but also I don't want to lose sight of it because, systems can go down. When I was working for the ERP system, during that year, we actually had a client that their system went down for a couple of days. So even though it's cloud-based, it went down. It was a freak accident that happened. So you still got to be able to do those manual processes as well. So you can't lose sight of that. But yes, my goal is to automate it as much as possible to make our processes more efficient and effective. So, getting the EDI and everything implemented to reduce the amount of time we're spending ordering supplies or, using the barcoding functionality. So it takes us half the time what it does to replenish supplies in the areas that we own the supplies in. So yes, definitely working towards that. Also, I will say one of my goals too is to take over more departments where I'm managing the inventory in to really help control the cost even more.
What are some areas that you're going to be evaluating the most in the ERP in terms of metrics? Is volume the biggest thing you're going to be looking at? Maybe just some areas of these are going to be, I don't know, KPIs gets overused, right? But what are the metrics that you're going to be keeping an eye on, especially right after you go live? And what insight are you hoping it's going to be able to provide to you other than GPO compliance? And then we'll move to we'll just dive right into GPO compliance after that.
Yeah. So I will say I'm blessed that the actual ERP system that I'm implementing is the one I worked for. So I already have
Wait, hold
you got an intimate knowledge of what it can do.
So I already have a pretty good idea. And plus I used the software for 6 years prior. So I already know what I'm going to be able to get for the system. But really what I'm hoping to do is really improve our expiration. The amount of supplies that we're expiring is not what I'm used to. So I'm hoping to really reduce that and run some reports on that. Also, another thing is, the departments that I'm managing the supplies and really look at the par levels, what I'm requisitioning out. Does it really make sense? Cause I'm already questioning, do they really need a case of gloves when we're checking the inventory 3 days a week? No. So that's another area that I'm hoping to, really look at to, reduce the expense that's going to the departments as well. I will say the last thing is I'm hoping to have the GPO compliance data in there. So hopefully monitoring that as well.
Matt, thanks for bringing that back. Justin was going to get mad at me if I didn't stay on topic, but I wanted to come back to the GPO.
Which rarely happens. That rarely happens, by the way. But well done there, Idaho. Go ahead.
Hey, a tangent jump. That's what we do. We are a supply chain. We pivot, we morph, we go where we need to. So we're good at this, Hayes. Matt and I can do this. I'm feel confident with it.
Matt can do this.
No, all seriousness, Matt. What are some best practices you work with your GPO proactively to build that partnership? There's obviously we have all kinds of different GPOs that support across the U.S., but what are you doing to ensure that compliance or those metrics are built, that baseline data that you talked about? What are you doing as proactively? Are you meeting? Do you have KPIs? Do you have QBRs? Do you have monthly reporting? What are you doing, Matt, at your local level on a rural, critical access hospital? What are you doing to make sure that's successful?
Sure. So right now I don't have EDI, so I'm having to manually put in the orders right online. So I'm able to really see real time is the items that are the items that we're ordering, are they on contract or not? And if they're not, that's a signal to me hey, I need to look into this and see if there's a comparable item on contract. I'll check with the clinician to make sure, or check our stock to make sure we have enough to maybe buy a couple weeks. And then it's really going back to them hey, will this one work? Do we need to bring in samples? And the other thing is, I feel like some people might bring in the samples and they're like, no, that's not good enough. No, you shouldn't just stop with bringing in one sample. If the first one's not good enough, bring in more. Let's try something else to see if we can find something else that's, on contract.
Well, all right. So moving to that GPO compliance piece, what are some of the biggest challenges in the rural setting? Because I feel like it's just a whole different ball of wax.
It really is. We have to sometimes operate like a big health system because we get everything. You know what I'm saying? So when you don't see that many patients, but you require all of these supplies, it can be hard because some of these distributors, obviously they're charging a markup, but then they're also charging a lump fee, so low unit measure fee, or they'll also charge you a freight factor fee, which, can be some high cost. So it's just making sure that you're buying stuff on contract, but also is it reasonable? Am I really going to fuss over $70 or $5 or $10, right, on this order? Or am I just going to go after the ones that are maybe $100 or $200 that will be a big deal? That's kind of my philosophy. But I try on my item master. So 2,000 items. I got less than 100 items that don't have a contract tied to it.
Do you know where the line is on the low unit of measure penalties? Can you pull a report and then start to tackle that? Just because it just seems like it's just dollars out the door. It's one thing if it's a specialty product and it's one of a kind, but I'm imagining that due to the size of a critical access facility, you can get dinged on those when they are avoidable.
Well, on the distributor that we use that I'm ordering online, I can tell if it doesn't have the marker where you can buy a lower unit measure, you're going to get dinged for the low unit measure volume. I also have worked at another critical access hospital where that's not the case. It's all, I think, tied to which possibly health system you're tied to, whether you get charged that low unit measure or not. So that's another thing. Maybe some hospitals that are critical access, if you're tied to even a larger health system, you might not see those fees. So yes, we're an affiliate of a larger health system, but we kind of operate a little bit differently than what some affiliates do. Like how we're a part of a GPO is we're a part of another affiliation with 20 other hospitals in Iowa. So,
like an aggregation group?
Yes, exactly.
So to define it though, y'all have roughly 25 beds, roughly?
We're 21 beds, but I will tell you for our hospital, we see a lot of PT, OT, and we do a decent amount of surgeries.
Okay.
And that aggregation group, you said it was what, like 20 other facilities? I'm imagining they're all critical access?
Yes. And also we're a part of another aggregate that includes 30 more hospitals that are in Illinois, Kentucky, Ohio, Missouri. So, yeah.
So you get a little, now when you talk about your GPO strategy, is it tied into that aggregation group or are they running in parallel?
Some of it is, but I will say it's more parallel because we're on a special tier because I'm a part of this group that allows us to get even more special pricing, right? That has to make it even more compliant. Like, generally with GPOs, you have to be 80% compliant. Well, with the tier that we're on, it's 90%. So you got to really pick and choose what you're buying off contract.
So, when we talk about GPO compliance, trying to get a handle on, how many different factors are in there, right? So you've got an aggregation group, you've got the GPO, you've got different tiers, it starts to add some layers of complexity. I wouldn't say they're obviously necessary because you're trying to drive the best price any way you possibly can, right? For the fiscal health of the hospital. But how are you going to leverage the ERP specifically, not only to find GPO compliance in general and identify opportunities to work with those clinicians to find another product that's on contract, but also how are you going to kind of know that changing landscape between best pricing through the aggregation group versus best pricing through the GPO, since they are kind of running in tandem?
Yeah, that's a great question, Justin. So what I'm currently doing with my item master, I'm actually collecting all the contract data with each item that has the expiration date. And I'm using a data field on my actual product. And that's where I'm going to put all the data. So I'll be able to pull a report, say, hey, this contract 1, 2, 3, these are all the products assigned to it. So let's say the contract expired and the vendor isn't renewing. I'm going to be able to pull a report and see all those items that are included on that contract that I'm using to look at, this is what I need to be looking at switching to the new vendor that's going to be on the contract. So that's how I'm leveraging it to make sure I'm keeping up with all the contracts I have to manage, because there's thousands. I mean, literally there is, and it's hard to maintain. I remember I used to, at a prior critical access hospital that I worked at, I was writing by hand. I literally had a sheet back, front and back. And I remember the CEO walking in. She's like, "Oh, what's that?" I said, "These are all the contracts I have to keep track of." And her eyes just lit up. She's like, "Oh my gosh." Yeah, it's a lot. It's a lot to manage.
And Matt, I'll bring in one other piece to this. As you're talking about the ERP piece with the GPO piece, one thing is you're switching out products and approval, Zing out items. Your distributor comes into play as well, correct? That is a large piece of this. We haven't touched on it. So how do you make sure your distributor is part of this conversation? If you're going to direct OEM or you're going to go through your distributor?
Yeah, that's great point. So what I've been doing, honestly, the last 6 months when I've been switching products, usually because the distributors have a stocking requirement, right? So I'll say, okay, hey, Fred, this is what I'm, send them an email. This is what I'm switching to from this product. Do I need to buy up any? If so, I need to know that. And then this is what my monthly usage is going to be, right? And it's also looking at, because some of those contracts you have to buy direct. You can't buy through a distributor.
Great point, man. I think that's the point I wanted you to say. You don't have the option sometime. You have to go direct OEM, and that's something we miss in those agreements. So great point.
All right. So as we look at rural settings, what's your biggest concern for the future of supply chain? You obviously have a lot of experience. You've seen it from several different angles. you've also been in that acute setting. So, and you understand the differences intimately, I believe. What's your biggest concern, as you just kind of look at challenging times for smaller rural community, critical access, that setting? What scares you the most?
I guess, Justin, to be honest with you, the people that, when I'm going to be retiring, who's going to be in these positions, because I will tell you, I've done some consulting on the side, and typically what I'm seeing at these critical access hospitals is they're hiring people without any supply chain experience. It's usually, an accounting background, and, it's, materials management or supply chain is, with accounting, they're combined, but there's different aspects. It's no different than trying to stick somebody in supply chain and an accounting career, right? It's going to take a long time to really understand that. And it's vice versa the same way, taking an accounting person and putting them into a supply chain position. So I'm worried because there's a big gap of knowledge here that's going to be missing.
Is it the logistics piece that scares you with hiring a finance person?
It's not just the logistics, it's also the contract piece, right? Like I'm explaining, what I've found is people are really struggling, especially in critical access hospital setting, understanding the GPO. So then you're trying to put somebody that has even less knowledge about supply chain in that position. Yeah, that's not good. I mean, supply is the number 2 expense in any hospital behind labor. So, and I think some of it too is it's the areas that we live in, right? You don't have as many applicants. You don't have that knowledge like you do in the city.
Well, let me ask it a little different way. So that's a negative, if you will. That's a concern that you have. But what gets you excited? What wakes you up in the morning and say, I'm ready to go to work?
Hayes, I love the challenge. I really do. I love the challenge. I love the people that I work with. The organization that I work with, the admin team is awesome. They've been very supportive. I've made a lot of changes. I mean, a lot. And they have not shot me down once. They're open. And, I like going to work knowing that I'm making a difference. People in our positions sometimes think, oh, because I don't touch a patient, I don't make a difference. That's not the case, right? Justin, you're a clinician. We're as important as the nurses. And I think we found that out even more in COVID. And I feel more appreciated now than I ever have. So that's what gets me going. That's what gets me to go to work every day.
I love it. Love it. And go Vols. Yeah. Go job. Good job.
Yeah, I think it's great. You might have felt a little invisible in the past to some extent, but that passion was obviously always there. And so, now that you sounds like you're in a great culture. I feel like that's one major benefit to critical access. Smaller, manageable culture where everybody can pull together as a team and accomplish that common goal a little bit more easily without the layers of, additional administration. Sometimes, we get disconnected. I think that's how silos happen. And do you feel like there are silos in your organization still?
I think there are some, but I've already identified them. And, I feel like, what I can do to my part to minimize them, I'm going to try working towards that, because I also worked at a critical access hospital where we really took those silos down and there was clear communication. I also feel like the hospital I work at now, or the organization, I can go to anybody and ask if they're willing to change something, and they're open to it. They're not going to shoot me down. They're like, hey, let's look at it at least, right? That's all I'm asking.
Yeah. Matt, great job. Love your passion for your work, and want to say thank you for kind of answering the call as we put it out there, just for people that are following Power Supply or aren't, and maybe have a success story. They definitely should have a success story or a topic that they wanted to talk about. And Matt, you took us up on the offer, obviously not having ever met any of us. And so I just want to thank you for taking that step and coming on. Have you been on a podcast before?
I have not. So this has been a great experience, and I appreciate all you guys. Seriously, I loved it.
Awesome to have you, Matt.
Excellent, Matt. Thank you very much.
Great job. Well done. Go Vols.
That was Matt Hoffmann, Director of Materials Management at Humboldt County Memorial Hospital. And Gary had another episode really talking specifically to those listeners out there working in critical access and rural hospitals, trying to find ways to save money, be fiscally viable, that might be compliance with their GPO and contracts. And so just thought Matt did a great job with that. And obviously he's got some experience working for a company that provides an ERP previously and having set up or beginning to set up the ERP at his existing facilities today.
Yeah, Matt did a good job of talking how to connect the ERP with the GPO and just the multiple hats you have to wear to make that successful. His knowledge base of a critical rural hospital makes it even tougher. I mean, you got to have that knowledge. You got to have some good mentors. You got to be ready to jump into whatever situation you have. And this is a big part of it. It kind of reminded me of our previous guest, Shane McGuire's conversation on another rural hospital setting. And it's just a tough go. It's a little bit different, but it seems like he's got some great direction, great knowledge to make it successful. So I just like how he really connected the GPO and the ERP and his clinical teams all on the same page. So great job. Great job with Matt.
Well, thanks to Matt for responding to my outreach on LinkedIn. And if you've got something that you're posting on LinkedIn that you think is a hot topic and one that we should be paying attention to, go ahead and tag Power Supply in, and we'll see your comments there or your post on specific topics, and we'll reach out. Maybe we'll have you on a show like we did with Matt. Definitely always looking for great guests and conversations, especially from those of you that are actually doing the work on the front lines out there every single day. So on behalf of Gary Hayes and myself, thanks for listening to this episode of Power Supply.
Bam!
Thank you for listening to this week's episode of Power Supply. As a reminder, you can help support us by subscribing on your favorite podcast app or by downloading the smartphone app on your iPhone or Android. Simply search for Power Supply in the App Store or Google Play. The best thing about downloading the smartphone app is that you can access bonus content for certain episodes and view episodes in certain categories, like articles on the go and vendor spotlights. Are you following us on LinkedIn or Facebook yet? If you are and you love an episode or post, then let your social network know about it. Like, comment, or share our posts along with your thoughts and keep the conversation going. If you have any topics or guests that you would like to recommend for a future episode, just send us an email to info@powersupplymedia.net. We look forward to hearing from you.